Welcome to Habitual Excellence, presented by Value Capture. This podcast and our company helps you and your team achieve habitual excellence and get better every day by focusing on one clear goal, one set of values, and one way of working. In simple terms, we want to help you create more value by providing the best care and the safest environment for both patients and staff. To learn more about Value Capture and our services, visit www.valuecapturellc.com. Listeners, welcome to another episode of Habitual Excellence. I am really excited and looking forward to having Dr. Ben Schwartz, who leads all of academic delivery for Banner Health, which means within one of the nation's largest health systems in the rapidly growing West. He is running not one, not two, but three academic health systems within the larger system, on the hospital side, ambulatory docs, whole thing, and is going to talk with us today. Ben and I are going to talk about sort of leading academic health systems for excellence, which is the DNA of Ben's leadership, as we're going to talk about, in 2026. And it is 2026. We're recording this on draft day for the NFL, which is hosted here in Pittsburgh. I'm coming from Western Pennsylvania. Ben is in Phoenix. We won't hold that against him. Good pick yesterday. And but I mentioned 2026 because everybody leading in healthcare now knows it's a time of really interesting challenges and significant ones, and stress on leaders, but also some really interesting opportunities are starting to open up, especially through innovation thinking and great leadership. And again, I think Ben is a great one to have on us listeners. So bragging on you, Ben, but will you introduce yourself to listeners? Tell them a little bit about, I consider you sort of a doc's doc and a patient's doc first, and a leader is, of a systems is something you've grown into. So talk a little bit about your background, where you come from.
Yeah, I'd love to. But before I do that, Ken, let me just say, that over the last several years, I've had a chance to get to know you and to follow your career. And it's so fun for me to have the opportunity to talk to you this morning. I appreciate very much being included.
Of course.
If I try to describe myself, I think I start off first and foremost as a proud dad of 4 kids with an amazing family and wife. I'm a gynecologic oncologist by training. The apple does not fall far from the tree. My father was an OBGYN. My sister Sarah is an OBGYN. So I come from a family of physicians. I started after my training, I actually lived in Pittsburgh, where you are, in academic medicine at UPMC and a place called McGee Women's Hospital, and went on to join my father's private practice on Long Island, where I'm from, for many years. Like many private practice doctors, ended up being acquired by a health system. I joined Northwell Health, now going back over a decade ago. And credit to the team at Northwell, they put me through a leadership development program, which was a locally run program, which really, for me, was a bit of an eye-opening experience when you do your own personality inventory, And actually, that led to a wonderful opportunity to grow as a leader within Northwell, and eventually move to Michigan to be the CEO of Beaumont Health, which now is Corwell Health East, as part of the larger system that's between Grand Rapids and Detroit. I left there a couple of years ago and took on an advising role with McKinsey, mostly assisting their teams at academic medical centers across the country, which was a really fascinating opportunity to sort of see under the hood at some of the country's leading academic medical centers. And now find myself on Amy Perry's team at Banner Health in Arizona, where we're one team, we're together, but we do have sort of divisions within the system. And we have our academic assets and our non-academic assets. I support the teams that lead our academic hospitals and medical groups, the service lines and institutes, and our foundations. I've been here for about a year and a half now, and adjusted beautifully to the warm, gorgeous weather here, and did not have snow last winter, and I'm settling in really wonderfully.
It's great. And thanks for sharing all that. And I think, it's always an amazing leadership advantage in healthcare where no one coming from any angle can sort of talk about experiences that you probably haven't had something similar to or can relate to. And I think, the way you've grown up through your practice and your history, um, allows you to lead in that way, knowing the basis that everybody you serve is coming from, or at least having a great sense of it. But I think there's more to it than that. And, we were introduced by another great leader, part of your Harvard class, as you continued your education. And I remember being struck right away that I was going to be a fan of yours because you told a story and you were at Northwell about a powerful department chair coming in and asking for resources and how you sort of shifted the conversation to, I think there's no reason, there's a Corwell, there's no reason we shouldn't be shooting to be the best in the world at what we do. And when he started asking you questions about how you're going to do that, you replied that you told him, I don't know, but I believe in you and I believe in the teams. And, there's nothing anybody else has that we don't have. And, I'm going to be right there behind you, supporting you and holding us accountable for getting there. And I said, wow, this is a habitual excellence leader. And it felt ambitious to me. It felt people supporting, but also, like we're going to go, and we're going to go from here to here. And that's just sort of what we live for. So could you talk a little bit about just your leadership style and philosophy? Because usually leaders who behave in that way, it's pretty deliberate. And, how do you think about that? And where does it come from? And, just talk a little bit about your leadership style.
And what do they say? What got you here won't get you there, kind of thing. So I will use the term loosely, grew up as that cancer surgeon in the operating room, my way
Mm,
of the highway. And I perceived through my ego and bravado that I was the only one who really understand how to do it right. And either you did it my way or you weren't part of the team. And as part of my leadership journey, I learned through education, the Harvard program, as well as self-reflection, that leadership, particularly now in 2026, is truly servant leadership.
mhm.
And I had a really wonderful opportunity earlier this week to meet Stephen Covey. He wrote this book, Trust and Inspire. He's internationally recognized author in leadership. And he describes wonderfully that we should be gardeners, not mechanics. And what he
Yeah.
means by that is that gardeners create an environment for seeds to grow.
Hmm.
They create the atmosphere uh, and sort of nurture growth, as opposed to mechanics that generally try to fix people, right? And it's so true, and the story
Yeah.
that you told, I say it all the time. I say, somebody says to me, what's your vision for thoracic surgery? And I said, well, look, we want to be the best in the world, whatever that means. And we can talk a bit about what maybe I think that means. But when they say, well, how are we going to do that? I'm always the first one to say, you're asking a gynecologist from New York how to make thoracic surgery great in Arizona. I feel like my job is not to know the answers to everything,
Right.
but particularly in these large matrixed organizations, it takes a little bit of street smarts and credibility to create an environment where our leaders can grow and be successful.
Yeah.
These are complex matrix organizations that sometimes finding the person to say yes, it can be really challenging. And I feel like that's my value proposition to Banner and to the university, is that I'm the person that facilitates greatness. In healthcare in particular, we're blessed that just about every clinician has
Yeah.
trained at some of the best places in the country and have been
Yeah.
around the
Yeah.
country, right? So they've seen and know what's awesome.
Yeah.
And sometimes institutions can get stuck in, this is the only way we're willing to consider doing
Yeah.
it. Creating an environment where they can share their expertise and genuinely lead with influence and accountability. We expect results. It's not
Yeah.
a just do whatever you like. I think is a really special part of my life. And I think it is the leadership of the future. And certainly if you ask Stephen Covey, he'll echo that sentiment.
Yeah. Yeah. Awesome. Okay, Ben, I'm going to take the bait.
Mhm.
Greatness in thoracic surgery. Your answer is not going to be, specifics around thoracic surgery, but you said we could talk a little bit about what you think greatest or being the best means. What are some of the criteria, that are in your mind that would have you feeling like you're headed that direction or your folks are?
Yeah, I think, the when you talk about strategic alignment with team
Yeah.
members, particularly in these really large organizations. Northwell's the largest employer in the state of New York. Banner's the largest employer in the state of Arizona, and we're actually across 6 states.
Yeah.
When you say something strategic, it means different things to different team
Right.
members. We at Banner, we feel very strongly that greatness is being the most trusted health partner
Hmm.
for not just the patients that seek care with us, but also our members because we have a very
Right.
large health plan.
Yeah.
Part of that is when we think about trust, part of that is I trust that if I come to you, I'm going to get the best outcome for whatever challenge I'm facing. And part of that, and I think the real value of academic medicine in a place like Banner, is that our academic enterprise is wonderfully stacked with expertise, teams that are capable of doing some of the most amazing, quaternary, complicated care. And
Yeah.
so part of our value proposition to the organization is that patients trust us because they know no matter how complicated my problem is, there's a person there that knows, that
Right.
is considered an expert in that. So part of that is, how do you, for example, find national recognition for the work that you're doing?
Yeah.
How do you create an amazing patient experience?
Yeah.
How do you reassure patients and educate them? How do you actually focus on value-based care and keeping people healthy? That we're here to help you. And I think in some ways we want to, as amazing as our orthopedic surgery program is, we equally want to be the place that avoids the most hip
Right.
replacements, not the place
Yeah.
that does the most. And
Yeah.
and that
Yeah.
cultural connection brings all of our team members, not just the providers, all of our team members in alignment because we feel like we're serving the greater good and that we're being trusted by the people that come to us.
Amazing. Amazing. Okay. All right. So let's talk a little bit about how healthcare, including academic systems, have been buffeted in recent years. And you used a phrase with me as in an earlier conversation when we've talked about sort of we got knocked off some of our fundamentals, a couple of just the fundamental principles that have always led to kind of the best outcomes that, you know, echo that kind of um, powerful alignment feeling between teams, patients, et cetera, in healthcare. So what happened to us? What did we get distracted from? And where are you and Amy Perry and others making sure that Banner centers? You've talked a little bit about it already, I think.
I think anthropologists will have an amazing time at reflecting on how the COVID pandemic changed the world. Certainly in our world, as someone who lived through that in New York, which was
Mm.
hit so terribly,
Yeah.
the public's trust and faith in the healthcare system has gone through this unbelievable sinusoidal um, experience where, you know, fire trucks were greeting us when we went to work every day, and the world so appreciated the
Right.
amazing heroism of our nurses and doctors that were walking into harm's way every day. And I think trust in the health system at that time was at an all-time high. And then whether it's around what's happening in Washington or other things, trust in health care has really diminished over the last several years.
Yeah.
Nurses still rank very highly, by the way. Pharmacists rank very highly. But generally speaking, physicians and health systems have a lot to invest and do to regain the trust of the public. When we talk about patient experience, what's really fascinating, and we have partners that help us to measure these things, what's a bit of an eye opener for me is that the most common metric that you can chase to improve patient experience is around, does the patient feel like the team is working together as a team? Do they feel the transitions of care are being managed in a way that's collaborative? And do they feel the culture of the organization is patient centric and collaborative and focusing on one team and teamwork? And so our focus, and Amy's really wonderful with this, our focus is really, we say we want to be patient centric because of course that's our consumer. Those are the people what we're so focused on. However, to make that experience great, we have to focus on our team first. And if we can get the culture right amongst our team members where they love coming to work, I always tell everyone I'm measured best by that feeling that our team members have when they get in their car or get on the bus or the train to come to work in the morning. Are they excited about where they're going? Because if they are, the magic of how their attitude about their work, the pride that they take in the work, the joy that they get from the work is something that the patients feel, even if it's not something they say out loud, you can sense it. And then you feel like you're going to a great place to get care. And so if you take care of your people first, of course, the patients are an amazing priority, but to get them the experience and the outcomes they want, we focus on culture.
I'm coming out of my chair right now because, there's no comment I can offer that would convey my enthusiasm for the elegance with which you've expressed that. And I think the sense that anyone that's worked in an organization, let alone a healthcare organization, is probably feeling like I am right now, which is like, that's so right. Like, that just feels so right. Love it. Okay. All right. So that's what you're striving to achieve. You're doing it, with some great results, etc. Lucky to have you. We actually know some of your academic system CEOs who serve under you, and they are great leaders too. And we know they're kicking out the jams. Um, but everything's not so easy or clear right now, as you've talked about leading very large organizations. And one of those things that's a challenge right now for a lot of academic systems, but also large health systems, is thinking about strategy and metrics and deployment and what's the right sort of measures that are real, and that when we move them, we're moving the whole enterprise clearly and in a virtuous kind of circle toward the kind of uh, holistic excellence that reinforces itself that you described. So you're in a very high seat in a very big place around this sort of deployment metrics, American medicine's millions of metrics challenge right now. How are you seeing it at Banner? What insights do you have? What can we learn?
Well, I certainly wouldn't want the audience to think that we absolutely know the perfect answer to this question.
Yeah.
I think you've beautifully asked the question that challenges most C-suites in healthcare, not just in the United States, but around the world. I think Banner celebrates that we have real operational greatness. The way our operating systems work, we're one team, the way our corporate teams support the local governance. You mentioned our hospital CEOs. They are spectacular. And it's such a privilege and so wonderful to support them. And but even they sometimes will ask for help.
Sure.
The
As they
challenge
should.
becomes that, Amy likes to say it's like hydraulics, when you put pressure on one, something else is moving. And there's no any one metric. I'll give you an example. How do you find the balance between needing to staff to meet the needs of the patients and throughput and everything else, while also being efficient enough in the model that you're able to keep the lights on at the end of the day? And so sometimes, from a senior leadership perspective, sometimes part of the art is figuring out, okay, for this specific team, this is the metric that we're going to hold you accountable for. And if the other thing isn't perfect, we accept that because we need you to be hyper focused on this. Length of stay, as an example,
Yeah.
is the focus. I will tell you, though, I think with artificial intelligence, one of the really exciting things about artificial intelligence is that we'll be able to recognize, leveraging all of our data, we'll be able to recognize all of the different variables and see them from a much different perspective, and probably have, I'm making this up right now, probably have the banner metric, which is a compilation of all of the different things that we look at and all of the different dashboards that we look at, and help our teams to understand when the work that they're doing is aligned with our strategy or not.
Yeah.
Because, and then the other challenge, I mean, your team is so wonderful at this, and you think about the value of your team in helping people change the way they look at these processes and building the infrastructure around process management and team alignment. The metrics evolve, and they're
Hmm.
evolving. What we used to
Hmm.
look at before, I mean, if you look at some of the national ranking systems, just a few years ago, they didn't even look at patient experience.
Yeah.
And now it's a major priority. So I
Yeah.
think you also have to be fluid enough to recognize that it's almost like growing up. When you're in third grade, you become really good at something, and then when you go to fourth grade, you're focusing on something else.
Yeah.
It's an infinite game, and we're constantly evolving to the needs of the communities we serve. In particular, in the world that we're in right now, I think if you're in the audience and you're at a large health system and you're not thinking about value-based care,
Yeah.
you need to start thinking, understanding better what that is,
Yeah.
because those are the sort of metrics that we're thinking about now and shifting focus to.
Yeah. No, it's exciting. Um, what you just laid out there, again, common challenge and subject maybe of a part two podcast with you because I like talking to you so much about it. But
Hmm.
um, it's interesting. We think a lot of the secret sauce in solving that conundrum is exactly the thinking you laid out before, which is when it's really going great, the people feel great, the patients feel it, and sort of lots of things start to get better at the same time. And sometimes C-suites naturally think, sorry, about deploying and, we need to work on that and that and that. But it's sort of the same units, right? So if we can get everybody thinking in a more horizontal flow way, it sort of clicks, that maybe the problem is we want to look at all the metrics, rear view mirror, make sure we're not missing anything. But what we really need to do is get that virtuous cycle that you described of the people and the patients flowing, and then challenge people with kind of the ambitious, well, how can we do that and be efficient, to keep the lights on, and pull them into that cycle. So I know you guys are headed that direction, but we could talk about that stuff all day. But I know metric deployment, and it's such a challenge, and we have too many metrics. All right. So if you want to talk with Ben more about that, get in contact. All right. So there's another area where you guys, I think, are really interesting and really innovating, and one of many others you could talk with your peers about. But that is in the very nature of the health system and the academic enterprise itself. And this is really, structure, process, outcome. If we remember our Donna Bedian, the structure of the relationship between the universities and the health systems is not the same at all academic centers. And it is a significant variable that does have an impact. And you've observed that to me. And could you sort of talk about what you all are doing to try to move that in an even more ideal way and, get into governance and some of that stuff?
Yeah, it's really exciting here. I think, first and foremost, when you ask about the structure of the relationship, it's really important to emphasize relationship more than structure.
Right.
I think every situation is a little bit different. Our relationship between Banner Health and the University of Arizona is really special. And it starts at the top. Suresh Garamella, who's the president of the university, and Amy Perry, who's the president and CEO of Banner Health, cast a very large shadow. And their symbiosis and collaboration sort of set the tone between the two organizations that we're going to make something really powerful where 1+1 is 100 kind of thing.
Yeah.
Having had the opportunity to look under the hood at several academic medical centers, there are some structural differences to the way we're set up here that I think are worth calling out, recognizing again that the structure is really great, but it's the relationships. Patty Prelock is the provost of the University of Arizona. She and I meet weekly. I love working with her. She is an amazing leader. And I think she gets a tremendous amount of props from me as being a large part of why our relationship works so well. But big picture, unlike many academic medical centers, which are embedded in a larger university structure where the head of the health system is reporting up to the president of the university, we are separate organizations with an affiliation and a co-governance in our academic part of Banner. So that structure is basically says, in summary, that we're working together to bring the strength of the University of Arizona's higher education, research programs, educational programs, national reputation, mission for the state of Arizona in alignment with the strength of Banner Health and our ability to provide care and create an environment where our faculty can do research and our trainees can learn. The way that governance works is we have a committee that is half Banner, half the university.
Yeah.
It has the deans, it has our senior leaders at Banner, and the provost and I co-chair that committee. And just about everything that we do in collaboration has to get through that committee, and the only way it gets through that committee is if the vote is unanimous. So we, as a natural outcome of that structure, it helps to build trust because nothing that we do can happen without full transparency and collaboration and communication and looking at any of the moves that we want to make, whether it's starting a new training program, creating a new clinical program, hiring more faculty, creating a different way to do research. I can tell you that story as a lesson learned.
Yeah.
But the bigger picture is relationships are, again, based on trust, and trust only happens as if you are making decisions together. Historically, before I got here, our relationship with the university is a decade old now. And I think many people in their minds were, that's a university thing or that's a Banner thing. And where Patty and I are so aligned is it's an us thing. It's a we
That's
thing.
awesome. Yeah.
Right. The research thing is a great example, though, because both organizations are highly motivated to be a destination for clinical trials and clinical research. Both organizations have wonderful people that are part of their infrastructure to get clinical trial administration done efficiently. One of the biggest pain points for our faculty when I got here about a year and a half ago was both organizations were terrific at it, but together the process was extremely bureaucratic.
Yeah.
And it could take a very long time to get a trial underway. And last summer, we got together and we said, okay, look, we're going to try as a pilot. We're going to try best practices in one place. We're going to try best practices in the other place. And let's every 6 months, kind of like almost like a prospective cohort trial. Every 6 months, let's stop and look and see what's working, what's not working. I don't want to tell you how long it used to take, but it is literally less than 1/10 of the time now that it used to take.
When you look at the actual value-added steps, it's amazing what can happen.
It is really awesome.
Yeah.
And I think I use this analogy, but I certainly wouldn't want to be perceived as in any way judgmental, but in our relationship, all of our resources are going towards healthcare, education, research, delivery, as opposed to in some university environments where certain undergraduate programs, I'll pick on the language department, Spanish or physics or something, the university needs to rely on the health system to help subsidize those programs in a way. Because of our relationship and the way it's structured, everything that we do is going back into healthcare, our tripartite mission of great care, clinical research, and education. And so where most academic medical centers are contracting or are at least maintaining the status quo, we're actually growing year over year. We're growing the faculty, we're growing the programs, we're growing the number of undergraduate medical students, we're growing the number of trainees. In the context of Banner, from a mission standpoint, feels very strongly about training the next generation of providers.
Yeah.
And, we have about 1,300 trainees, residents and fellows. We have over 7,000 nursing students.
Yeah.
We're able to do that because of the way our relationship is structured and also because of the people that are interacting and how collaborative they are.
So Ben, as you talk with such confidence, clarity, and directness, again, I think you've got some peers coming out of their chairs, and I think the things I hear that I think should be exciting for all of us are, first of all, wonderful how you took structure and centered it foremost on relationship, and the sense of principles around a commitment to trust, and then. I, as a listener, heard it only moves if it's consensus. And it's like, oh man, nothing's going to move ever. Right. And then, oh no, but trust is a superpower of leadership, right? Which is rooted in integrity, right? Fundamentally. And then that actually unlocks speed and innovation and all, and the willingness to do all this kind of stuff. And you gave that great example of the clinical trial setup and taking the time down to a tenth of what it was. And I just hope everybody understands the link between principles rooted in the best of us as humans, and then that allows these virtuous cycles to really take off. It's great to hear. So, all right, I'm a fanboy, clearly. It has been great to learn from you, for this episode of Habitual Excellence. But I think I know others already do, but some listeners are going to want to be able to learn more about Banner Health and what you're doing. Are there any things you want to highlight for folks or sources where they can learn more, about what you guys are cranking out in terms of innovation and care out of the academic side of the system?
I mean, look, we're so proud of it. It's such a large organization. I think I really appreciate the opportunity to share some of our successes with you. And I feel like we touched on so many of the key big components. I am on LinkedIn. I made a career as a practicing physician of giving all of my patients my personal cell phone number. I think if your audience has specific questions, they should feel free to reach out and message me there.
All right. What's your handle on LinkedIn, Ben?
Oh, well, I should know that.
Probably not hard to follow. Just Ben Schwartz, MD, Banner Health. He'll pop up.
Yeah.
All right. So, listeners, thanks for tuning in again. If it's easy, like this, wherever you got the podcast, and if you haven't yet subscribed, Ben is a great informant among others. And, we'd love to have you follow the series. So, Ben, thank you so much for doing this. I know I'm even more excited for the people of the 6 states that Banner serves, but especially, the transparency of learning that can help everybody at this moment, which is challenging, but also exciting. And I think I'm coming out of this conversation feeling opportunity. So thank you, Ben.
Yeah, Ken, thank you so much for having me. And again, a tremendous joy in my work to have the opportunity to spend time with you and learn from you. And I appreciate the opportunity to spend the morning with you. Thank you for that.
Thank you.
Thanks for listening to Habitual Excellence by Value Capture. We hope you'll subscribe to the podcast. Please also rate and review it in your favorite podcast app. To learn more about value capture and how we can help your organization on a journey to habitual excellence, visit our website at www.valuecapturellc.com.